Nurses are an essential part of any healthcare system facility, especially when we talk about cardiac nurses. Cardiac nurses have a high level of education, such as a master's degree in nursing and a postmaster certificate in cardiovascular specialty. They are also required to have plenty of experience that allows them to treat conditions that affects the heart. In addition, they work and promote cardiovascular health with preventative measures by doing counseling such as healthy diets and stress tests. Cardiac nurses also provide care for patients with heart conditions in the cardiovascular systems, such as angina, heart attack, coronary heart disease, and heart failure. These specialized nurses work alongside with cardiologists, and they are traditionally employed in hospitals and the cardiology units. Cardiac nurses are able to treat pediatric patients and other patients' populations that have a heart condition.
So what elements are needed to become a cardiac nurse? Becoming a cardiac nurse will typically take 4 to 6 years, and this depends if one gets a Bachelor of Science in Nursing or an associate's degree in nursing. It is advised that you earn your BSN since hospitals are looking to hire BSN nurses over ASN nurses. In addition, all cardiac nurses must be licensed RNs in their state. The National Council Licensure Examination for Registered Nurses, or NCLEX RN, must be passed in order to become a licensed RN. Finding a position as a new nurse in a cardiac unit will be challenging, so they must first gain experience working elsewhere. Ideally, they would want to begin working on a telemetry unit where they will gain knowledge on electrocardiogram monitoring and heart conditions. After gaining experience for 2 years, they should get certified in the cardiac field. Certifications show that they have become an expert with all the knowledge and skills they have gained. The following are certifications that one can obtain and that they will be valid for 5 years. 1. Cardiac Vascular Nursing Certification. 2. Certification for heart failure. 3. Cardiac medicine certification. 4. Cardiac surgery certification. And 5. Advanced cardiovascular life support. These certifications are offered by either the American Nurses Credentialing Center or the American Association of Heart Failure Nurses. To further develop in cardiac nursing, consider getting a master's or doctorate in nursing.
Some responsibilities of a cardiac nurse are giving health assessments, administering medicine or treatments, post-op care, rehabilitation, and education. A patient's medical history, current health issues, and symptoms are examined as a part of a health assessment to look for potential heart disease symptoms. Additionally, they may involve taking vital signs, listening for abnormal heartbeats, observing the patient's intake and output, taking pulses at all extremities, and checking the general tone of the skin. Cardiac nurses monitor a patient's medications and their side effects, making sure they are administered or discontinued as prescribed by a doctor. Their insertion or removal of an IV or chest tube. After surgery, cardiac nurses will continue to monitor post-operative patients after they are released from the care of the PACU nurses for complications like infection, hematoma, heart attack, and blood clots. Cardiac nurses assist with rehabilitation. This can start while you're in the hospital and go on for months after a cardiac episode. In order to recover after a significant heart condition or surgery, a patient may need to adjust their diet and engage in exercise. Cardiovascular nurses also provide important education for patients and families as needed to make sure they understand everything that is going on.
Cardiac technology. A cardiac nurse may use a wide variety of technology. A blood pressure monitor is commonly used by any nurse to measure a basic vital. This is used to measure the pressure in your arteries and your heart rate. Some monitors also include an attachment to measure oxygen saturation level in the blood and body temperature. A common device you may have already seen is an AED. This is used to treat cardiac arrest in an emergency. There are many other common cardiovascular tests involving technology. A cardiac nurse may perform, monitor, or come in contact with an electrocardiogram, which is used to record the electrical signals in the heart. A Holter monitor is worn by a patient to record the heart's rhythm. A pacemaker is a device a patient may have surgically implanted to help the heartbeat maintain a regular rhythm. An echocardiogram is an ultrasound that uses sound waves to create pictures of the heart's blood flow through the heart and heart valves. A stress test shows how the heart works during physical activity. These are just some of the many cardiac technologies a nurse may come across.
I will be explaining the types of cardiac nursing, which are pediatrics and elderly patients. For pediatrics, I will need to care for congenital heart defects that are experienced by infants and children. As for the elderly patients, we will be focusing on how to maintain cardiac health. For pediatrics, some are born with a hole in the heart, or born with low levels of oxygen, or other diseases, which these will require surgery soon after they are born. Nursing roles include assessment, discuss the procedures with parents, give pre-op and post-operative care, and then caring for the infant or child after surgery. It is the nurse's duty to make sure that the baby is cared for and remains stable until fully recovered. These include monitoring of growth, providing good nutrition, and managing pain with meds as needed. For the older adults or elderly patients, one of the biggest impacts on them after cardiac surgery is loneliness. Age is a factor, along with changes in their life, including moving to a nursing home and needing help to care for themselves. The nurse's responsibility is to monitor cardiac and vascular readings, as well as supporting and motivating patients' lifestyle changes. Evidence suggests that exercise-based cardiac rehabilitation programs improve cardiac health. Older adults that face depression, anxiety, and loneliness after cardiac surgery can benefit from exercising, aerobics, game activities, and maintaining a wholesome diet. Regardless of age, the greatest impact a nurse can bring to a cardiac patient is helping their mental health, as it does improve their mood, ease depression, and provides more energy for the patient. As we all know, being in a good mental state provides a great foundation to heart health and overall health in general.
Conclusion, cardiac nursing is a very important part of nursing that is needed in many hospitals and in many fields due to the huge importance of maintaining the function of the heart. Despite this simple idea, there are many options that a cardiac nurse can work in, such as pediatrics and acute cardiology care. When it comes to becoming a cardiac nurse, it usually requires many degrees and plenty of experience for a person to get into. Generally, 4 to 6 years of learning along with an associate or bachelor degree is accepted, but cardiac nurses also must have a registered RN along with many certifications that are specific to that cardiac field. Cardiac nurses are also very important due to their contribution to the surgical and specialized work because they provide the best care for the patient due to their specialized skill in cardiac conditions, along with the knowledge of the equipment. They monitor the vital signals of the heart, which is one of the most important parts of the body. They play an important part in educating the patients on how to take care of their heart and provide comfort and care to those in times of distress. And they work with other members of the nursing department, which allows them to give the best possible service of the patient.